name's Zoe. We're going to be doing our NG tube pass off, and we've verified the order that the doctor's given us that this patient needs an NG tube, and I've gathered all my supplies. So we're just going to come into the patient's room. Just going to knock. Hi, my name is Zoe. I'm going to be your nurse today. I'm just going to close this door for privacy. We're going to be putting an NG tube in your nose. As the doctor's order, I'm just going to check your wristband to make sure you're the right patient. Can you tell me your name and date of birth? Perfect, okay. So we're going to be placing this NG tube. It's to release the gas that is in your stomach. And then I'm just going to raise your bed up a little bit so I can have you at a working height. Sit her head up a little bit so it's in a high Fowler's position and like a 45-degree angle. And then, so I'm just gonna get all my supplies out here real quick, so I don't have to. I'm just gonna place this over your chest in case you have any fluid come out. If you have any questions or concerns, just let me know. This process is going to be a little bit uncomfortable. It's not going to feel good. And so this tube is just going to go up through your nose and then it's going to go down into your stomach. I'm also going to place this pin right here just in case you do have to throw up or anything like that. Then we're just going to get this tube ready. And then you just let me know if you're feeling too uncomfortable, anything like that, and we will stop the procedure we would stop the procedure if they had any, like, if they couldn't breathe, if they couldn't hum, if they are having coughing, just if anything went way bad, if they weren't feeling good, anything like that. So I'm just gonna measure this. I'm just going to inspect her nose and see which one. I would say that her right one is the one. Can you tell me which of your nostrils you breathe out of better? Can you take a deep breath in for me and tell me? Okay, so she said her right one as well. I'm just going to measure this right here to make sure we have I'm just going to go from her nose to the pharynx and then down to her xiphoid process so that we have the correct length, so I'm not putting it too far down into her stomach. Okay, I'm just gonna mark on my tube real quick where that was so I know where to stop. Whoops. Maybe. Just gonna get this ready. Just gonna lubricate at least 2 to 4 inches of this going up her nose. And then, okay. So we're gonna start this up your nose. It's gonna be a little uncomfortable. You just tell me if it gets too bad or the pain's unbearable. And then I do have this water right here for you, and I'll tell you when I want you to drink that, okay? Okay. Start up her nose. Then I would twist it. I wouldn't force it. I would twist it if I couldn't get it to go, but I wouldn't force it to the point where I would be hurting them. Okay, right about. Okay, there we fill the back of the pharynx, and I'm just gonna have you tilt your head forward and take a drink of this water. Put your chin down, have you drink this water, and I'm gonna have her hold that and continue to drink it while we advance it. I'm just gonna be watching for that mark that I made to make sure that we don't advance it too far. there's my mark. I'm just gonna hold this right here. You doing okay? Okay. I'm just gonna hold on to this and tape it down real quick. Trying not to pull it out or anything like that. We're just gonna take this loosely to her cheek for just a little bit. And then while we did this, we would obtain a chest x-ray to make sure that it is in her stomach. And then we've done that and it looks all good, and now we're just gonna pull a little bit of fluid out to make sure that it is down in her stomach. I'm just gonna pull 5 mLs out. Okay. I'm just gonna put this back on for a minute. We're not hooked up to suction, so I'm just gonna set that like that. Now we're just gonna test the pH of it. Make sure that it is the right acidity for her stomach. I'll just stick this in here. And then it's about a 5, 4 or 5, so it's looking good there, nothing to worry about. And now we're just gonna attach it to her nose so it will stay. I have gotten too big a piece of tape. I'm just going to put this on her nose. And then we'll take this piece off and we're going to keep a hold of it to where it's not going to be pulling in or out or anything. And then we're just going to wrap these around here. Side wrapped around. Okay, you doing okay? Feeling okay? Alright, I'm just gonna move these out of the way real quick. I'm gonna have you look to your left real quick so we can get this attached onto your gown. I wonder if I don't have a pin, but we're just gonna tape it to her gown so that when she does turn her head or anything like that, it's not trying to pull out of her nose or anything. But we would tape it. We would pin it so it would stay better, but I don't have a pin, so we're just gonna tape this for now. That way it pulls on the gown before it's pulling on her tube to come out of her nose. Okay, you feeling okay? Alright. I'm just gonna pull this off. Perform some hand hygiene. We're gonna get you hooked up to suctioning real quick. I'm just gonna pull this off. Hook this up here and make sure. Oh. Is that there right? Okay. Make sure that that is above her shoulder level, and then I'm just gonna put her. Oh, just kidding. We're gonna perform some oral hygiene first before. So we are gonna be doing some oral hygiene on you. When you have this NG tube in your mouth, it is gonna cause a lot of dryness. It's gonna make it so you can't, your mouth's gonna be dry and you just feel like you can't get enough mucus in your mouth. So I'm just gonna clean your mouth out and make sure that's all there. And then we'll be coming back every 2 hours to do that. And if you feel like you need that more often, just let us know and we'll come back and help you. And just clean this up and put everything away. And we're just gonna put you back down to where you're comfortable. I'm just gonna lay your head down, you tell me when. Right about there, okay. Okay, so we come back and check on her, and then I'm just gonna go document and make sure that we have everything in the computer.